Hello, and welcome to the University of Ottawa Heart Institute's Cardiac Surgery Prehabilitation video series. My name is Catherine Caldwell, and I'm a nurse in cardiac rehab at the Heart Institute. As you follow along this video series, you can use the Waiting for Cardiac Surgery and the Cardiac Prehabilitation guides for a reference. Both these guides are available in English and French and can be accessed through the Surgical Triage Office or on the University of Ottawa Heart Institute's website. And these are the guides that I'm referring to. Waiting for cardiac or heart surgery can be an emotional and stressful time, not only for the patient, but also for the family, partner, or friend supporting them through this journey. It is normal for not only the patient, but for the caregiver to worry and feel stressed. Therefore, this prehabilitation video series, or prehab, as we affectionately call it for short, video series, was developed by the can you change the slide, please? Was developed by the multidisciplinary team of nursing, physiotherapy, social work, and dietetics to provide information and education to help you better prepare for your upcoming surgery. Next slide. The benefits of prehab include improved physical and psychological readiness for surgery, reduced complications after surgery, reduced length of stay in hospital after your surgery, and improved transition from the hospital back to the community. Next slide. We have divided this presentation into 4 parts so that you are able to view the information in shorter segments. It is important that you view all 4 videos as they are equally important in preparing you for your upcoming surgery. This table you're looking at right now acts as a table of context. Once you have looked at the videos, you can go through this and review or look at different ones you'd like to see again. We hope that you find this information helpful. It's a privilege for us to be involved in your care. Please remember that don't ever hesitate to reach out. We at the Heart Institute are always here for you. Our first speaker today is Esther Doucette, and Esther is a social worker here at the Heart Institute in cardiac rehab.
Thanks, Kathy. Thanks, Kathy, for that introduction. As Kathy has indicated, I am the social worker in the cardiac rehab program, and I'm going to talk to you more specifically about some supports, resources, as well as practical concerns and how to address them. So upon discharge from hospital, please be sure to have somebody that stays with you for at least 1 to 2 weeks post-surgery to help you attend to your needs and upon your return home. If you do not have anyone to stay with you, you can look into places to stay temporarily for extra support. You might consider staying at a friend's home or have somebody stay with you. You might also consider staying at a retirement home or a nursing home. And typically, these homes, particularly retirement homes, will have per diem rates where you can stay for a week, 2 weeks, 3 weeks, whatever your needs might be. So you'll want to look at things such as location of that retirement home, availability, and certainly what kind of nursing supports might be available for you in the event that you need them. If you need any assistance navigating that, you could certainly give us a call. I've also provided here a link to the Champlain Healthline where you can find the list of retirement homes available. You might also want to consider how you can call on people to assist you in your care once you return home. Often family and close friends are eager to support you. And so here are some suggestions as to what they could assist with. Certainly meal preparation. I always say never refuse a meal. Grocery shopping certainly can be helpful as well, because that can be quite time consuming. Light housekeeping, depending on the season, either cutting grass or snow removal. Certainly transportation assistance, getting to appointments, etc. And even having somebody come in occasionally to provide some friendly visiting. So coming and staying with you, playing some cards, whatever it is, to help reduce some of the isolation that people can feel during this time. It's really important before anybody comes in for surgery to ensure that your power of attorney has been completed. Power of attorney includes assigning someone to attend to property and personal care decisions. So when we mean property, this includes paying bills, attending to banking needs, managing investments, paying and selling a home, for example. So it's really important to assign somebody to attend to those things. In addition, having a power of attorney who can attend to decisions regarding personal care is also very important in the event that you're not able to make those decisions on your own. So making medical decisions regarding housing needs and other aspects of your personal care while you're in hospital. Make sure that you approach your bank to complete those forms regarding personal power of attorney for property. Certainly, I have attached the link to the power of attorney kit with the Attorney General in Ontario. The link is below. It's useful to complete that link. However, specifically, often banks require that you complete their own power of attorney forms for property. So certainly check into that. You can also speak to a lawyer regarding completion of those forms. I wanted to talk just briefly about private insurance and medication coverage. If you do have private insurance, you might want to verify what that insurance entitles you to. But please note that we do have a few private rooms within the hospital. However, those are left specifically for people with particular medical conditions in which they need to be placed in isolation. So even if you do have access to private rooms, it may very well be that those rooms will not be available to you. We're very fortunate though at the Heart Institute, most of our rooms are just 2-person occupancy. You want to also verify what kind of medication coverage you have. If you do not have private medication coverage, certainly look into the Ontario Drug Benefit Program as well as the Trillium Drug Program. And below on this slide is the link to the Trillium Drug Program in Ontario. Important to think about how we care for ourselves, not only as the patient, but as the primary caregiver. So this can be a very stressful time for everybody involved. So really need to think about putting your oxygen mask on first and taking care of yourself, particularly as the primary caregiver, because your health is just as important as the health of your loved one. So here are a few tips. Talk to someone you trust and who won't be judgmental of your concerns. Don't forget to do things that you enjoy, whether that's going out for a little walk, watching videos, playing board games or cards, whatever it is, finding things that you enjoy. Hobbies included. Take time away. So having quiet time might involve meditation, engaging in your hobby, whatever it is, find some quiet time for yourself. It might even be spiritual time, prayer time, whatever it is, find some time, quiet time for yourself. Take note of the things that you're grateful for. During these difficult times, sometimes we can get so caught up in our own stress around the particular situation at hand. Useful to also note just those small things in life that we can be grateful for. Changes of season, the loved ones around us. Whatever it is, it's a great time for reflection. Be forgiving of ourselves and others in our lives. The old "don't sweat the small stuff" is a little important nugget to hold on to in stressful times. Notice the present moment. Notice the changes of the seasons. Notice your breath. And my next point is to engage in deep breathing. So deep breathing, when we're stressed, we also often have very shallow breathing. So engaging in more deep breathing slows down our breathing, helps to stimulate our parasympathetic nervous system, so we actually can relax a little bit more. So don't forget about that. That's a very accessible tool that we have within us that can really help to manage our stress. And take mindful moments throughout your day. Take a few moments in the morning to sit quietly, take a few breaths. When you're making a meal, when you're brushing your teeth, be aware of those sensations while you're engaged in those activities. These mindful moments can really help us once again to manage our stress throughout the day. And I'll pass this on to Kathy now.
Thank you, Esther. Our next speaker is Amy Charlebois. Amy is the advanced practice nurse for cardiac surgery at the Heart Institute. Hi, Amy.
Hi, everyone. So happy, to be here for this webinar. It's so important for you and also for your family. So I always say this. I said this at the intro, the pre-op, I would say, webinar piece in my other presentation, that it's so important that you have somebody to listen to this webinar and watch it as well. Your loved one or the person that's going to be staying with you after your surgery. They're very important in your journey and are a second set of ears, because we can't remember everything just ourselves. And especially after surgery, you will be tired, and that's okay, because you're healing. That's normal. So we're going to talk about that, what's normal, what to expect, and all of that. So I just wanted to say hi with my video. And I'm gonna just take my video off so you guys can focus on the slides, and we will go from there. Alrighty, just give me a minute there. Oh, just one moment. All right, so a lot of patients ask, how long is the surgery going to be? Generally, not for all cases, but for most cases, the length of the surgery, the whole process part, is about 4 to 6 hours. Okay, so it doesn't mean that you're necessarily having surgery for that entire time, but the whole process part of it is about 4 to 6 hours. So what happens while your family's at home waiting for your surgery to be completed? How does that work? And what does that look like? So after your surgery, so say example, you're booked for surgery in the morning. I don't know if you remember my previous webinar, but there's 2 times in the day you could be booked for surgery, whether it be in the morning or the afternoon. So if you're booked in the morning, again, you'll probably go for surgery around 7 or 7:30 in the morning. And then if you're booked in the afternoon, you'll probably be going for surgery around 1 or 2. So example, if you go for surgery in the morning, the surgeon will call your main contact person, your family member, directly after your surgery with an update. We usually don't give updates in between. It's usually just at the end of the surgery, okay? So example, if you go for surgery in the morning, the surgeon will call your family probably around 1 or 2:30 in the afternoon with an update. Now, on that note, I know Esther, the social worker, was talking about the importance of having a power of attorney and having a contact person. But when you come into the hospital, it's so important that you have one main person to be your contact person. So that way, any communication, we know that we're giving it to the right person, and also nothing gets strewed. Everybody's getting the same information. So your main contact person can tell everybody what's going on. So that's really important. So make sure you have that prepared before you come in for surgery as well. Now, the other thing is, what happens right after surgery? Where are you going to go? What does that look like? So when you're finished your surgery, then what's going to happen is you're going to move to the surgical ICU, or intensive care unit. When you move there, the nurses will set up your medications and all of these things. You will be asleep, and that's normal, okay? You'll probably be asleep for the first at least 4 hours or so, or a couple hours, or a little in and out of sleep when you move to the ICU after your surgery from all of the anesthetic, and that's okay. When you're in the ICU, the nurses will actually call your main contact person with an update twice a day. So they will call them around 9 in the morning or so, and around 9 in the evening. So you'll know you'll always get those calls for an update. If there's something out of the normal, they'll call you for that as well. So you don't have to worry about that. But you can always call the Heart Institute if you need to contact the nurse or you need another update. So the other thing is I'll talk about this shortly, how long you'll be in the ICU. But when you're transferred from the ICU to the surgical ward units, that's where we get you ready to go home. Your family member, your contact person, can call with an update, or you can even call your family member. And I always say, put them on speakerphone if you've got a cell phone, or even the phone in the room, and you can make sure that they're involved when the doctor comes in the morning with an update. Or when the nurses are doing education, so they're part of that as well, and they know what's going on as well. Because like I said, it's a lot of information for somebody who just had surgery, and it's nice to have a second set of ears with somebody who's going to be staying with you and caring for you after your surgery. So length of stay in the ICU. So right after your surgery, you're going to be in the ICU for about 1 day to 2 days, okay? So that's normal. When you wake up from your surgery, you're going to be given IV medication. We're going to be taking care of your pain. We're going to be asking you all of the time, how are you feeling? And I usually always say the rule of thumb is if anybody's having more than about 2 or 3 out of 10 pain, to let your nurse or your care team know, because we want to make sure you're comfortable. We really will try and get you up and moving as soon as we can. So it's very important that you feel comfortable to go for your walks. That's going to be very, very, very important. So like I said, about 1 to 2 days you'll be in the ICU. Some people might have to stay a little bit longer. Example, if their heart rate might be a little bit irregular or something like that, and that's okay. If that's the case, we will keep you there, but otherwise about 1 to 2 days, and then you'll move up to the 3rd floor or the 4th floor, which are our ward surgical floors. And that's where we're going to be looking at focusing on getting you ready to go home. So total length of stay. So average, the total length of stay in the hospital for your heart surgery is about 4 to 7 days. So of course it could be longer than that. That's a possibility, but just to give you guys a bit of an idea, about 4 to 7 days is the average for patients being in the hospital. what resources will you receive while you are here? So you're going to get this Recovering from Cardiac Surgery booklet. It is available also on our website, and the link is right here as well, as you can see on the slide. So all of the information, including your exercises, what to expect, your contact numbers of who to call if you have any concerns after you leave, after your surgery, it's all in this booklet. So if you or your loved one wanted to, you could take a look at it on the website, and it's a little bit more in-depth information about what to expect after your surgery and even when you go home. We have a couple of other patient education tools, which I'm going to go over a little bit further in this webinar. It's the incision stoplight tool and our weight tracker tool, and I'll show you that after so it makes more sense. So I talked about this a little bit already in the pre-op webinar area, but the recovering part I'm going to talk about again because it's so important. So if you have an incision at the sternal bone or at the chest bone, it's really important that you don't lift, push, or pull anything more than 5 to 10 pounds after your surgery date for about 6 to 8 weeks, okay, or until the bone heals. So your bone needs usually at least 8 weeks to heal and to become strong. You will have some wires there to help it heal and to help it keep strong, but it's really important, example, that you don't use your hands to push yourself up out of a chair or that sort of thing. As I said, we're going to give you a little teddy, a little pillow. We'll actually give you one to take home. That's compliments of our alumni. We're so grateful for them. But they're going to give you a little teddy, a little pillow to take home. So it helps to remind you not to push on your hands or get up that way. And that's going to help make sure that your bone heals. It also helps to decrease any risk for infection. Again, we want to keep our incisions clean and dry. So, you know, I mean, we're coming into the fall months right now as I'm recording this webinar. But, you know, in the summertime, sometimes you can get sweaty. If things are moist or things like that, that can actually incubate bacteria. So we don't want that. We want incisions areas to be nice and clean and dry. So that's important, especially also for female patients, especially if you have larger breast cup size. So you want to make sure, you know, that we try and wick away any moisture caused by the breast to make sure the incisions stay clean and dry, especially at the bottom there. So again, with the female patients, we want to make sure that you bring in your comfortable fit front closing bra to help with that incision and your pain as well. The other thing that's really important is to make sure you don't have anything irritating or rubbing the incision area. We always say the scab is like a natural Band-Aid. It actually is helping your incision heal. We like it to be clean and dry, like I said, no oils or creams or lotions on the incisions until they're fully healed, like a white scar line. So that's so important. If you have any questions about this, again, Regan, the physiotherapist, she's going to go over in her webinar examples of how to move and how to practice this at home before you even come in. So you'll be well rehearsed. So again, my minimally invasive patients, so your precautions might be a little bit different. So if you don't have an incision at the chest, but you have an incision at your side or at your pec area, just don't lift anything heavy more than 10 pounds until you see your surgeon for follow-up. Keep your incisions also clean and dry. Sometimes it could be under the pec there, so it can be a little bit moisture. So we want to make sure it's wicked away and it's clean and dry. Avoid the irritating and rubbing. And just on a side note, our minimally invasive patients, they may be more likely to be discharged on, you know, a day 4 after surgery, just because they're able to move around a little bit more. And you may be cleared to drive a little bit earlier or return to work earlier. Again, though, this is so dependent on how you're feeling and after discussion with your surgeon, okay? So that's very important. And if you have any questions about this, please bring it up with your surgeon. So this is one of our tools that we give out to our patients because, you know, I'm giving you all this information and you get this information in the hospital, but it's a lot of information to take, and it's okay to forget. That's why we give you these tools to help you remember. So it works like a stoplight. So green means go. It means keep on driving. You're doing everything great. Yellow means caution. You need to put on the brakes. You need to contact somebody. Red means you really got to put on the brakes. You need to contact somebody as well. So this tool is especially for your incision. So we ask that our patients look at their incisions every day. We want to make sure, some people even take a photo of it so they can do comparison. Your family member can take a picture. I don't know, you might find it kind of hard to look at your own incision after the surgery. So you could use a mirror, a camera, or you could use a loved one to take a look for you. And just take a look every day. Make sure it looks dry. Make sure there's no drainage. Make sure there's no increase in redness or opening or any signs of an infection. And keep it clean and dry. No ointments or creams or powders. Say you went home and something changed and you looked at your incision and it was a little bit more warm to touch, more red. Maybe there was a new opening or some new drainage or something like that. The important thing is that you do not delay and you do not wait. You call us right away. So you can call your surgeon's office or you can call our nursing coordinator number. The phone number is on all of our tools, but it's 613-696-7000 extension 0. It is a 24/7 number. We will not call you back most likely immediately, but we should always call you back that day. Okay. So it's very important for you to call us right away. One thing I notice about patients is sometimes they're hesitant or nervous to call us if there's a problem because they don't want to bother us or they want to wait to see if it really is a problem. So they might wait a couple days or something like that, even though, you know, our information says that you should call us. So don't do that. We want to know. We want you to call us. We're very you know, thoughtful of you healing and making sure you do the best. So the best thing to do if there's any concerns, especially with your incision, to call us that day that you notice the concern, okay? The red zone, that's when there's probably an infection. So that means you also need to call us right away. So there's an opening or it is quite warm to touch. You look at it and you think there's an infection. So that's something you would call us for right away as well. So just like I said before, any concerns with any of your incisions, do not wait. You're going to call us that day. Now we have one more tool. So this isn't necessarily for all of our patients. This tool is more for patients who have a history of heart failure, or maybe they probably have a history of heart failure before they even came into the hospital, and they were checking their weight every day before they came into the hospital to make sure that they weren't gaining fluid weight. We also actually ask for all of our valve patients, so valve repair or valve replacement patients, to use this tool as well. So it's a weight tracker tool. So what we recommend is that you check your weight every morning at the same time. Usually I say before breakfast, after you go to the bathroom, so it's accurate. Use the same scale every day and don't move it around. Keep it steady and write it down. So the important part of this is sometimes after surgery, you can retain fluid, but it's fluid and it's not weight that you've gained because you're eating too much spaghetti or eating too much food or anything like that. It's different. So the thing is with that is that if you are retaining fluid after surgery, it's something that we want to address right away. So to make sure that it doesn't become something that makes you feel short of breath at rest or something like that, and the fluid comes into your lungs, that would be something a little bit more urgent. So we want to prevent an emergency, really. So some of our patients don't have any issues with fluid at all, but there are some people that we just have to keep an eye on it. So you check your weight every morning, you write it down, and when you're in the green zone there, same thing as the other tool, works like a stoplight. When you're in the green zone, no weight gain, no increase in swelling, you have no increase in shortness of breath, everything's a-okay, then that means you're doing well. Continue what you're doing. If something were to change, you go to the yellow zone. Say you gain 2 pounds in 24 hours or 5 pounds in a week. Again, it's probably not because you're eating too much spaghetti or something like that. It might be an early sign that you're starting to retain fluid. So you want to call us so we can catch it early. Because if you went into the red zone, that means you might have unrelieved shortness of breath at rest, or wheezing, or feeling like you need to sit in a chair to sleep. That means you might have some fluid, a lot of fluid in your lungs, and you might need to go to emergency. So we're trying to prevent that. Okay, but like I said, this is a tool only for certain patients. But just to give you a heads up before you come in and give you some education before you come in about that. So there's some general guidelines after surgery. Again, I'm just kind of briefly going over a lot of our education that we talk about. So these are some general guidelines. Everything really is in our Recovering from Cardiac Surgery book. So you'll get that after your surgery. But generally, after your surgery, there's no driving for at least 4 to 6 weeks until you see your surgeon for follow-up, okay? Of course, your family can pick you up and take you home and drive you to your appointments and stuff like that. But you as a driver, no driving for at least 4 to 6 weeks. You should wear your seatbelt in the car. Some people ask me that, but yes, absolutely, you should wear your seatbelt. Your coat or your sweater or your clothes and your little teddy should protect the incision from rubbing against the seatbelt. A lot of people wonder, when can I go back to work? So about 2 to 3 months, give or take. So if you're working, then it's usually about 2 to 3 months. If you need a letter for your work or anything like that, it'll be the surgeon's office that you can follow up with after the surgery. And they can organize that as needed. Some people think that they're going to get better right after surgery. You know, it's been 2 weeks since my surgery. Why don't I feel stronger? You know, what's going on? I thought I'd be better right away. It takes at least 2 to 3 months really to get all your energy back after surgery. And for some people, it can be even longer. So be patient and just know that that's normal. Slowly but surely every day, things will probably get a little bit better. But the big thing is to know that that's okay and it's going to take time. Eating well. So our dietitian, Kathleen, is going to go over this. But a lot of people underestimate how important food is in actually helping you heal and decreasing risk for an infection. So we want you to eat lots of protein. Some people after surgery, their appetite's a little bit lower, but we still need you to get all those nutrients so your tissue and your muscle and your incision can heal. So if you're not really that hungry for like a big meal, maybe you could eat 5 to 6 smaller meals throughout the day. But if you're really having an issue with it, even after your discharge, you can contact us and we can get you referred to our dietitian. Walking exercises. It's so important to do your walking exercises. Our physiotherapist is going to give you a program to do at home, and Regan's going to go over that with you. But that's really, really important. It's important for your blood circulation. It decreases our risk for blood clots, and it helps you feel better, and it helps fluid in your body as well. Helps make sure that you don't retain fluid. So blood glucose. So that's when you do that little check if you have diabetes, to check your blood sugar level. So Kim, our diabetes nurse, she's going to be going over this with you, but that's so important. It's important before surgery and after surgery. When your blood sugar levels are really high, you know, even if it's just above 10, the blood in your body becomes sticky. It's kind of like slow moving, like maple syrup. So that can increase your risk for an infection and other things in the future. So what we want to do is help to make sure that those levels are in the normal range. Then your blood's kind of like water out of a tap. It's moving nice and smooth, and decreases your risk for an infection. So if you're having any issues with that, then Kim is going to follow up with you guys in her webinar about who to contact. But that's very, very important not to ignore. Daily showers. So you can have a shower You know, once a day is fine. It's good to have someone around for the first couple showers that you have. You don't want to scrub the incision. The water and the soap will roll over that area. That's fine. You pat dry. We want to keep the incision clean and dry. Some patients ask, oh, am I going to need a nurse to do the dressing on my incision after I'm discharged? Most of our patients go home without any dressing or a bandage on the incision. It's just left open to the air. If you needed a nurse to do dressing or something like that after you were discharged, we would set that up for you before you go home, okay? Now, deep breathing exercises, that's really important too. It's for your lungs. We get you to do that right after surgery, because sometimes after surgery, the bottom of your lungs kind of stick together a little bit. So we do these deep breathing and coughing exercises, helps open them up and helps you feel better and breathe better. And Regan, again, is going to talk to you guys about that. And so you guys can practice that before you come in for your surgery. Like I said before, we want you to call if there's any concerns with your incision. That's so important. And then one of the last things is the importance of, there's a cardiac rehab program that we have about 8 weeks or so after you're discharged from the hospital, that we would really like you to be a part of. So we'll give you an appointment before you leave the hospital, or we'll contact you after you leave the hospital with an appointment. And it's so important. It actually can help decrease readmissions after your surgery. So it's so important. But Regan's going to talk about that program as well. And as Esther said, the social worker, it's so, so important to have someone ready to stay with you or help you out when you're discharged from the hospital, at least for most of the day, most of the night, for at least 1 week to 2 weeks. So it's very important to have that, just so you have that extra support. And like she said, if you don't have anybody that can help you out, or you're wondering about options, please call right away and she can help you out, absolutely. So prevention is the cure. So even after you've had your surgery, your heart surgery, it's so important to continue to, you know, listen to your body. So the important thing, as you know, balanced diet, trying to eat the best we can, regular exercise. If we have diabetes, making sure we keep that level controlled, avoid smoking, avoid excessive alcohol, trying to manage stress and our blood pressures, cholesterol levels, knowing risk factors. Genetics is huge. You know, example, if you have a commonality where there's a lot of people in your family, direct family, or not even a lot, just a couple people who've had heart attack at an early age, or heart surgery at early age, or heart history at early age, you should be following up, your family should be following up with their doctors to make sure that they're checked out. We can't change genetics. Understanding your medication is so important. Going to your regular follow-ups and investigating any new heart symptoms with your doctors. So I'm so happy that you guys have tuned in. You know, I just wanted to let you know we've got all our resources on our website. If you have any questions or concerns about your surgery that have not been answered yet, you can call your surgeon's office. You can call the cardiac surgery triage office at 613-696-7062, and they're open Monday to Friday during the day. And then if it's off hours, like on the weekend example, or in the evening, you can call the surgical nursing coordinator at 613-696-7000 extension 0. So I just want to say thank you so much. And all our patient tools, like I said, and the resources are on our website at ottawaheart.ca.
Thank you so much, Amy.
Thank you.
Thank you for watching this video series. Amy has gone over if there's problems to call the surgeon's office, or the cardiac surgery triage office, or the surgical nursing coordinator. Again, I just want to stress that we're always here for you. We can always answer a question, and please don't hesitate to reach out to us. Thank you.